As we continue to traverse the northern Pader district, our next stop is Lagotywec village. And we arrive at the doorstep of 15-year-old Marvin Opuka, whose skin has almost been stripped off by the cruel effects of nodding syndrome. His mother, who has been doing some chores outside, finally joins him. Marvin forlornly spends his time seated or sleeping on bare ground. The pain he must feel when he falls down, watching him through the camera lens, leaves us paralyzed with shock. He can't cry, and it is not because he's being a man. He just does not have the energy to cry, however much he may want to. Shedding tears is torturous. This is the torture he endures each and every day. He is finally brought out for an evening breathe, and signs of malnourishment are visible. The mother tries to care, but how much can she do for a son who won't stop being sick from a disease that no one in the village understands? And as we have a chat with her, word has already spread across the village that some help has arrived. One by one they come. On a bike, pushing it with determination, comes this man with another child, a 15-year-old boy whose energy has been dwindling over time. He looks dazed and confused. More continue to come, each with their own devastating effects of nodding syndrome. This gentleman helps us tell them that we are journalists here to carry their plight to the concerned authorities.
My request for the government, build the hospital which near for us to take this boy to hospital. Another problem we have, food. There's no food.
In fact, the nearest health center is Laguti Health Center on Gulu Road and Ukidi Health Center 3 in Kitgum District, a distance which can take someone hours walking, meeting with danger along the way. The leading cause of death amongst children with nodding syndrome is drowning, and it happens that most areas where they live, they are surrounded by rivers. Another cause of death is fires and falling on dangerous objects.
So the most important thing, we need all these supplies, like drug, dressing material.
Some who make it to the health centers are given medicines, but these are misused.
Unknowingly, or they tend to throw them away. Or whenever they collapse on their way, there's a delivery drugs there.
Emphasis has been put on caretakers being more vigilant, but they have to work. In his local dialect, this gentleman labors to elaborate what happens to his son. Yes, vigorous nodding of the head is always the first symptom recognized among children with nodding syndrome, and the name came about because of the head shaking, which mainly occurs when a child is given food or is in the cold. It is getting cold and later in Lagotywec village, and this boy just will not stop swaying. Marvin's mother is crooning him like a baby despite his 15 years of age. As we leave, the rain starts. Tonight, many of the affected children here may spend it nodding their heads and having seizures. Florence, NTV Kitgum District.